Heroin overdose deaths have doubled in just the last 2 years. 22 News reporter Eugene Cho standing by live in the newsroom to break down the CDC study and explain how Western Massachusetts fire departments will deal with these overdoses.
State and federal officials have called heroin and opioid abuse a public health crisis. An epidemic in 28 states, including Massachusetts. A new Centers for Disease Control study found that heroin overdose deaths have doubled in 2 years.
It doesn't surprise me or shock me.
Health officials blame the crisis on easy availability of cheap heroin. According to the Centers for Disease Control, 3 out of 4 new heroin users admitted to abusing prescription painkillers before using heroin. Heroin and prescription opioids act on the same receptor in the brain and produce similar effects. The federal government recently placed restrictions on prescribing opioids to help reduce addiction. Some people are skeptical.
We passed a law, we feel good about ourselves, and now the law enforcement aspect of it is left to pick up the pieces of, okay, now how do we enforce such a law that you just passed?
The CDC also recommended increasing the availability of addiction treatments and the overdose reversal drug Narcan.
Plug up one nostril and administer 1 milligram per nostril. And then we'd continue.
In West Springfield, first responders carry Narcan so they can quickly try to revive an overdose patient.
Once someone goes into respiratory depression or their breathing stops, everything else is soon to follow.
And recently, Massachusetts health officials have launched a pilot program to make Narcan more widely available. We have detailed information about that program on WWLP.com. Live in the newsroom, Eugene Cho, 22 News.